One of our observations, especially after Dr. Amy Atkins sort of was driven a little bit from office, is that the power structure, federal, state, has always continually pushed the onus of COVID-related enforcement to the lowest person on the tier. These feds push it down to the states. States oftentimes push it down to the county and the local government health offices, which are undermanned and they take on a lot of work. And then that eventually gets pushed down to the retail worker who's getting paid minimum wage. And my wife works in retail, and their minimum wage workers are told, don't confront the people, call a manager, and hopefully a manager will come over at some point. But, the person could already be gone by then too as well. Your latest curfew promises to punish those retailers for violations, yet there's no punishment for anyone else in the power structure for not taking responsibility for keeping people safe during the pandemic. The only reason that people are allowed to walk into a store en masse is because you've not enacted a second shutdown. Is this really a fair delegation of power in the power structure? Should we push this down to the minimum wage worker instead of, the onus being?
Yeah. Look, you've asked about 5 questions, so let me.
I'm the Jack Wallace of today.
Yeah, let me go through some things. First of all, I think historically in this country, we've looked to we looked at states, for example, to deal with emergencies. Think of a flood along the Ohio River. Think of tornado in Western Ohio. So the fact that the pandemic is being dealt with at the state level and the local level, I don't think is not abnormal. So that's one. Two, I have, been pretty active. Some of my critics would say much too active in this area. And so, there have been certain things that we have not dealt with locally. We've just basically said, we're going to deal with this as a state. We're going to have uniformity in this area. I put out the initial orders. We didn't rely on the local health department orders. Third point, our system, the way it's set up in Ohio, right or wrong, is a very local system, particularly in the area of health. I mean, these are almost semi-autonomous 113 health departments. So our challenge through this pandemic has been to kind of stitch that together and do things that we had not done before, and try to give support and help to the local health departments. So we have given them guidance. In addition to the guidance, though, we've given them money. And I'm on the phone every Monday morning, 7:15, talking with 113 health commissioners around the state. Whoever gets on, it's usually over 100 of them get on. And I learn a lot from them. We've also set up on tracing early on. We said, if you have trouble with tracing, we've got people at the state level who will do it for you. Now it's, we're all being overwhelmed right now, but we're scrambling to get more at the state level. And I have my commitment to them because they don't know what Congress is going to do in regard to CARES Act dollars. My commitment to them is you will not run out of money. I mean, we will do what we have to do. If it's not CARES Act dollars that you carry over, whatever it is, we're going to make sure, even if it's general fund money, we're going to make sure you've got what you need to do to test and to trace. So it's been that kind of a relationship. Your other point, and part of that relationship, I can just finish. Part of that relationship is just set. It was set. We didn't come in and devise this system. There is no system.
Right.
Now, just as another example, so much of this is tying in with what the hospitals are doing. So we really kind of set up a new system. Historically, the hospitals keep their own data. And so, early on we said, no, we got to have your data. We can't run this battle without working very closely with you. And we divided the state along with them into 3 regions. And, you've seen in our press conferences how we've explained that. So we've kind of built that as we've come along. But again, it gets to your issue of what does the state do what does the local do? So coming out of this, a goal I have, it's a goal actually I had before the pandemic, and that is to have a much more robust public health system in the state of Ohio and try to turn it into more of a system while respecting local control, which Ohio is famous for, which is fine, that's great, but also trying to figure out how they get the resources that they need. So that's a long-term challenge. Your point about the clerk, at the checkout counter in the grocery, and that she is exposed or he is exposed to people all day, is a point very well taken. There's absolutely no doubt about it. And throughout this, they have borne the brunt of the risk, or at least a lot of the risk that was involuntary risk, that they couldn't do anything about. And so, we put on, as you know, a mask order in July. We did it in the urban areas first. We did it basically where the red counties were, and they were all urban. So it really was the urban counties. We followed that then going statewide. And what we saw was that in the urban areas, the mask compliance in retail was good. We also saw in the rural areas it was bad. And so, we did come along a month or so ago, I don't know the exact date, but say, look, we're going to start enforcing this. We're going to send inspectors out. There was no mechanism to do this. There was no way to do it. And we just dreamt something up and basically, decided to take workers' compensation inspectors. This was the idea of our new health director. She said, look, we have these in workers' comp, let's take those. And amazingly, maybe not so amazingly, once we announced we were going to enforce it and started sending inspectors out, guess what happened? People started wearing masks. So we're tracking this every day, and we're in the 90%, up 90 plus now, of people wearing masks in retail establishments. So it's taken a while. But we have, significant protection today for that person who's shelving stock, that person who is at the checkout counter. And so, we've made progress there. We're going to face the same issue when we get to tier 2 of who gets the vaccine. Tier 1A is what we're at now. I think there's a pretty broad consensus. And that is that people who are the frontline health workers should get the vaccines. The people who are dealing, whether they are a nurse, a doctor, or just someone who's literally cleaning up, if they're dealing with COVID patients, they need to be vaccinated. There's also a consensus that people, over half the people who have died in Ohio from the virus have been living in a nursing home or some kind of care setting. So we know that has to be a priority. So that first tranche of people is clearly, there's a consensus there. But when we get to the second group, right, you're going to see, and we're already seeing it, everyone's raising their hands.
Robust debate. Yeah. How
about us? And everybody can make a very valid case. But, we are going to have to try to drill down and see, who, that person who she's 65, she's diabetic, she has to work, and she is dealing with people 8 hours a day as a clerk. We got to protect her, and we got to do what we can do at least, and not just everybody wearing a mask that comes into the place, but the vaccine. So we're not deciding today on this show when, where that person goes, but you make a very valid point that person is, very highly exposed. And when we look at where the vaccines go next, those people who are really exposed certainly are going to rate a lot of consideration.
And I hate to feel like I'm cutting you off, but my team is going to kill me for asking such a long question to start out with. So we'll go to Jess next. So.
Hi, Governor. I'm Jess Harden. We actually met at the airport a couple of weeks ago. Thanks for doing this today. So Mark mentioned Dr. Amy Acton, and I wanted to talk a little bit about that New Yorker article that she was profiled in a couple of weeks ago. In the article, she said she feared she would have to sign and enforce health orders that violate the Hippocratic Oath. I think a lot of people perceive the two of you being pretty much in lockstep for the beginning of the pandemic in enforcing and creating policy, and her leaving seemed to be a tipping point. I'm wondering, if there's any work that Amy Acton left on the table that Lance Himes had to finish, and what you think about her saying that she feared having to violate that oath. Did you stop listening to her?
No, I mean, I don't know exactly what she meant by that, but I continue to talk with her, and we continue to communicate. As far as her advice, she's one of the people that I continue to listen to. She also has helped me, not just when she was a health director, but since she's left that position, she's helped me identify national experts to talk to. So it's not unusual for her to tell me, I'll call her up and say, hey, we're talking about this. She said, well, here's a couple of people maybe you should try to get on the phone and talk to. So she's been very helpful throughout this. And, someone who really made a difference, when she was in that position. So that's about all I can say about it. She's a wonderful person and was a great director of health. And, obviously, as I said at the time, I was sorry she was leaving.
Was there any work?
Unfinished business. Yeah. Sure. I mean, when she left, there's obviously continuing business that goes on in the health department, and we continue to fight the pandemic. Lance has been I want to talk about Lance a minute. Lance has been someone with a great institutional memory, not a doctor, but someone who's been at the health department a long time, great institutional memory, great relationship with the 113 health commissioners around the state. So, even now, when we've had shored up the health department with a couple more key people, a number of key people, Lance is still really my main conduit for the local health departments. And again, as I said, institutional memory, and he's been very, very important. In Dr. Vanderhoff, I think we have someone who, really, fits the role of the chief doctor in the health department, a person who, is on virtually every call. I do a call every morning, 8:00 with senior staff. He's on the call. Rely a lot for his advice. And Stephanie McLeod, as I said, brought Stephanie in. She's a real go-getter. She's someone who makes the trains run on time, gets stuff done. Part of the challenge is just, getting this department so with all the moving parts that it has and all the things we're asking it to do during the pandemic that it normally doesn't do. It takes a real manager. So she's good at that. She's excellent at that.
Thank you. Justin's next.
Hello, Governor. I'm reporter Justin Dennis.
Hey.
What effect do you feel that civil disobedience efforts or apathy regarding your health orders has had on the state's job to control the pandemic, or the effect it's had on the economy? Much like the pandemic, misinformation has also become viral, and the state can run public service announcements and hold daily briefings every day, but it's obvious you're never going to truly reach the people who have already tuned out or are listening to another narrative that fits what they want to hear. To them, you're the bad guy. So how do you counteract that effect that has on public sentiment?
Sure. I mean, we live in a different world today than we did 15 or 20 years ago. People get their information from a lot of different sources today. And as you will appreciate, the internet basically has no editor. So, anybody can post about anything they want to post on the internet. That's First Amendment. That's fine. They should have the right to do that. So you can get some, really garbage on the internet as far as information. It's just the way the world is today. Your question, how do we reach people? Look, I don't think we're going to reach the people who much as we might try, who, demonstrate in front of the health director's house, as they've done for a few weekends, or people who, the guy that was yelling and had a bullhorn out on Conley Road yesterday and the day before, and the people who come visit us on Friday night and demonstrate and have basically a party on our road, the road that goes by our house. I don't think you're going to reach them. They have every right to exercise their First Amendment, and God bless them for doing that. That's what they want to do. But I think that, there is another group of people who, are guided by facts, and, they are tired. They're sick of the virus. They're sick of the pandemic. They're sick of everything, just as we all are. And I empathize with them. I understand where they're coming from. Fran and I feel the same way. We've got two grandbabies born the last month, and we can't hold them. We can't go down and we go see them from a distance, and we wear a mask, and, we do the best we can do, but we're sick of that too. But, I think these people are driven, by facts and reality. And for them, my message is, there's good news. And the good news is this vaccine is on its way. We're going to start vaccinating people maybe as early as this weekend. I don't know, whenever we get it. And there's light out there, and there's light at the end of the tunnel, and the spring is going to come. And, but we do have to we got to get through the next few months. And that's a tough message, but the governor has an obligation to tell people the truth. Governor, I am optimistic by nature. I think we're going to come out of this pandemic. It's been a great tragedy, great losses, but Ohio is going to move forward after this thing is over. But we've got to get through the next few months without, and with as minimal damage as we can. And minimal damage means people are going to have to, hunker down more. They're going to have to avoid contacts. People are going to have to assume that anybody they come in contact who doesn't live with them in their house has COVID. And people are going to have to assume that and take the appropriate precautions. We have spread that is greater today than we've ever seen it in Ohio, and it's universal. I keep telling people, we keep talking about the purple and the red, and it's just, at this point, it doesn't make much difference. No matter if you live in Noble County, Monroe County, or Franklin County, when you walk out and start interacting with other people, there's a good odds that somebody in that group is going to have the COVID, just the way it is today. So I have an obligation to point to the future optimistically, because I'm optimistic about it. But also to say, look, we got a few months that we got to hunker down and talk to people about this, and we've got to do what we have to do for the next few months.
Governor, in any of your 7:15 meetings or 8 o'clock meetings, has anyone advocated in the last month or two that the state reenact another shutdown? And if so, what percentage of that has your attention right now?
Well, we have very open discussions with our team, and everything is on the table. I don't know that we've had anybody who's advocated shutting down the state. I think the discussions have been, how do we get through the next few months? How do we protect people at the same time, understanding the complete shutdown of the state could be devastating in the area of mental health, could be devastating in many, many other drug use, drug abuse, many other things. And so that the complete shutdown is probably not it's not probably the best, but.
Just a quick point of clarification. Are you saying 0 people have suggested that we reenact the shutdowns from late March to mid-May?
Well, you're talking about all the people in the public arena? Is that what you're talking about?
No. Just the people that you're talking to, their 7:15 or 8 o'clock morning meetings.
I don't think anybody suggested a complete shutdown. We're operating under some basic principles, and I think that we all agree on. And the principles are that another complete shutdown would be devastating. But we also are seeing numbers that we've never seen in Ohio before. We're seeing our lowest county at about 4 times the high rate of spread that the CDC considers high incidence. So it is trying to figure out what are the things that we can do, that will help get us through here. We're going to really need, particularly between now and the first of the year, this is a crucial time. And when we have such a delay between a case where someone tests positive and the impact on the ICU, that could be 3 weeks, could even be 4 weeks potentially. So we know that what we're doing now, is going to impact us going forward. And so that's always what's hard to explain to people, I think. We're used to instant results. And so, we're living in a society where we expect, I'm impatient. I'm the most impatient person you ever find. And so, I want instant results. So we got to look at things. Where is this going now? I mean, for example, in the last few days, you have seen a flattening of the number of people actually in the hospital from COVID, total. But we also know with the high number of cases we're seeing consistently day after day, that probably is not going to continue. That in a while, those numbers are going to start going up. So it's, everything, we look at every option. I mean, we look at every option. Your question to me was, did anybody ever come out and say, we need to shut the state down completely? I don't know that anybody has said that. But I think there's a consensus with our team, and I think there's certainly with the Trump team, as far as the medical advice and the people we talk to, that we've got to really pull back now. And not just in Ohio, but across the country. And we're not going to I don't call it a shutdown, but we got to get focused on staying at home.
Right.
And we got to pull back significantly, and we have to only go out if there's a real reason. People go to work, fine, come home. People go to school, kids go to school, fine, go to school, come home. And, we just have to pull down. And, what we're seeing is we're doing well with wearing masks in retail. That you can check that box. We're doing as well as we can do pretty much in that area. Check that box. But My
family works in retail, so it's better. But
you understand, it's better. Look, it's better. Look, I mean, we know that there's still outliers. We still know people that are, we got those. But on an average, we're getting better than 90% mask compliance, in which we've always said if we could get 90%, we'd be very happy with that. We'd like 100, but that's working. But what's not working is someone goes, they go out and they go to the grocery store and they got a mask on. They come home and then, they drink a beers with their buddies for 3 hours and watch the Browns or watch the Bengals or watch the Ohio State when they're playing. Well, they've let their guard down. So we know what's happening. People are laying their guard down. So we got to, we're depending on people to fix that. Same thing in regard to your just contacts, lessening contacts with people is what we got to do.
And I'm going to try to get a couple more in before Dan kicks us off. I know Jess is next.
Yes. Governor, when asked about why you won't enact a second lockdown or a policy approximating the effects of that. You've repeatedly used the Republican talking points, which include increases in suicides and overdoses and abuse. Research.
Well, let me just interrupt. I don't think those are Republican talking points. They might be, but, I don't focus on Republican. The one thing you should have learned, I think, during this pandemic is I'm not taking Republican talking points. I mean, these are facts. I've got Lori Chris, who I listen to a lot. And Lori says, I could show, memo that she sent me 2 weeks ago, weekend. And in that memo, she says, look, we got huge mental health problems. Don't shut schools down. Okay. So these are not Republicans. I don't know what Lori Chris is, what party is she?
Right. Well, but we all know that President Trump has repeatedly made comments about how suicides would explode if the economy were to shut down. And that's infected a lot of it caused a lot of viral tweets on Twitter. And the data on suicide specifically does not bear out. There's been a lot of research showing that it's not backed by data, or at least not at the moment. A lot of it has been anecdotal or based on media reports of a certain person.
I'm not the expert in that. I'll let Lori Chris answer that question. What I have seen is that initially you don't see the suicides initially, early on in the pandemic, that would be incorrect to say that, but that at least you can say there's certainly later on you start seeing that, and you're seeing huge mental health challenges.
Of course, and I don't mean to dispute that there.
You got to let me finish. You don't see the emails that I get from people and everybody's got my email. So who tell me about their son, who tell me about their daughter, who is so depressed. And the reason they're depressed is they can't play sports. The reason they're depressed is they can't theater that they love and it has the passion. So I refused your premise that these are Republican talking points. And I would say that there are bad things that occur when you have a shutdown. That doesn't mean we shouldn't pull back. That doesn't mean we shouldn't be much more careful. That doesn't mean we shouldn't do a lot of different things. But a complete shutdown, has some serious other ramifications.
Absolutely. And I don't dispute that it has effects on mental health at all. But my question is more about what about people who are experiencing mental health effects by, going outside and being surrounded by folks that aren't wearing masks, or by, the healthcare workers who undoubtedly will have PTSD after dealing with the hospital crisis at the moment. I think that an undue emphasis has been placed on folks unable to participate in, sports or activities like that, and less of an emphasis on folks who are enduring people not taking this seriously. And so I think that a lot of that defense has been on kind of more fringe folks that are upset with the ramifications of lockdown versus the notion that the pandemic itself and enduring this and enduring a lot of folks saying that it's a hoax and that it's not real also has demonstrably negative effects on mental health as well. And so my question is more about why is there not emphasis on those anecdotal situations as well?
Well, I think you've seen in our press conference, for example, we've brought nurses in. Everything that you mentioned weighs very heavily on me. I try to take everything into consideration before making a decision. And these decisions, from my perspective as governor, are all difficult. And they all, at least during this pandemic, have involved choices rarely between good and bad. It's usually between bad and worse than bad. And so whatever you do or don't do, there are consequences. So all the things that you mentioned, I take into consideration. I pride myself in being a pretty good listener, and I listen to a lot of people out there. But I will guarantee you, I am not focused on the loudest voices or the people who are demonstrating. What's much more impactful for me is when I get an email from a superintendent who describes what is going on in her or his school district and tells me about all the different things. And look, I get it on both sides. I mean, I have superintendents, for example, who have begged me or pleaded with me is a better word, I guess, to keep sports open. I'm going through my emails and then get to the next superintendent who is just as adamant, on the opposite side. One is saying keep sports open. The other is saying you need to shut sports down. We can't do it ourselves. There's too much pressure on us, but it needs to be done. Here's the bad things I'm seeing. Got the other superintendent. I'm literally one email after another. The other superintendent is saying, look, you shut down sports. We're going to have all these kids are already depressed. They already have problems. Some of these kids are just, what's keeping them going is the ability to have sports or the ability to do some other extracurricular activity. So I'm not asking you to feel sorry for me, but I am telling you that I listen to what people say to me. I have to make the final decision. The buck stops with me. I'll take responsibility for the decision I'm making, but they rarely present a clear-cut case. If it's clear-cut, somebody else has made the decision before it gets to me. So it's easy one, but that's what you elect a governor to do. And, it doesn't mean I'm always right, but I do balance these things. And I don't think I certainly try not to give undue weight to one side or the other, or to one loud voice. It's not the loudness of the voice that influences me. It's the insight in what that person is saying and their ability to observe, their ability to see it when they're reporting something directly to me. That is important. If it's someone just blowing off and they're sending me email every day about something and they're picking up on the internet, I don't pay a hell of a lot of attention to it.
With Dan's indulgence, can we get one more question from Justin?
Sure.
Thank you, sir. I want Alan.
Hey, Governor, it's Justin again. So the U.S. Office of the Inspector General earlier this year announced it would prioritize several different audits, types of audits of nursing homes, including audits on state surveys conducted by state health agencies like ODH, and the characteristics of hardest hit facilities. And it expects to release a report on that next year. The FBI has investigated at least one nursing home that I've looked at in Beaver County, Pennsylvania, that's reported hundreds of cases, several dozen deaths. Here in Mahoning County, between 75 and 80% of the total COVID-19 deaths were a nursing home resident. One Trumbull nursing home here has had about 50 residents in late May, nearly a quarter of whom had died of COVID-19 by early August. A Mahoning facility had already reported 36 deaths by late May, which is assumedly more than a fifth of what its census would have been. Other nursing homes in our area, however, have reported few cases or deaths, if any at all, and they appear to have remained virtually unscathed all these months. Why do you think that is, and what sort of second look would you want to take at how nursing homes have been operating during this time when everything has kind of settled?
Yeah, it's a great question. And I ask myself that. We look at this from a short term and we look at it from a long term. A couple things. One, merely because there is tragedy in a nursing home does not mean that nursing home has not done a good job. It may mean that, but it does not necessarily mean that. Second observation, I have challenged our team to analyze for the long run, the state inspections that are done, the quote surveys that are done, how relevant are they? How relevant are they to keeping infection down or out? How relevant are they to the kind of care that the resident is getting? And I think, I've challenged our team, and they're trying to, build the train while running the train. So it's not easy, but in the long run, we have to have a full review of those surveys. How much good do they do? We should be in the nursing homes. We should be working with them. We should be helping them. We should be pointing out deficiencies. The question is, are we pointing out the right deficiencies? Are we pointing out the right things? Are we digging down? I don't know the answer to that, but I suspect that we can improve that. And that's one of the things I've told our team to do. So that's just some general comments about the nursing homes. We're obviously going in early on with the vaccine in these nursing homes because that's the people who are dying the most. And, if we can shut that down as far as the deaths occurring or dramatically reduce it, we need to do that just as quickly, as we can. But in the long run, making sure that Ohioans have consistent care throughout all our nursing homes is one of the priorities of our administration, and it's a long-term project, and I've made it very clear to our new health director that this is one of the things that she and her team need to focus on.
Well, Dan is telling me that we're ending now, so we would like to stay for longer. To be honest,
Dan is pulling the plug. He can be the bad guy then, huh?
Hey, Governor, how are you doing? Just yourself. This is tiring and fatiguing for everyone, but you're at the center of it all.
Yeah.
Even off the record.
No, I'm doing okay. Fortunately, I have a wife who's been through, this for years and public eye, and so it's this is a heightened intensity, with literally demonstrators out. The building we're in, which is kind of a guest house we built. We call it a barn. It doesn't look like a barn, but Fran and I were staying out here the other night because the demonstrators were making so much noise on the road, and we came out here to sleep. But literally, we woke up we didn't wake up. We were watching TV. Actually, what we're doing, we're watching something on Netflix. But anyway, the building starts to shake. And Fran says, "What's going on?" I said, I do my normal thing. I'm not going to worry about it. And so she wants to make sure that nothing is blowing up in the building. So she checks it out. She comes back and she says, "Okay." She says, "It's the demonstrators out there. They've turned the volume up so much that literally the windows were rattling." So, if we hadn't been through these things before, I think it would have been, tougher to go through some of these things. But we've done this, and I have a very understanding wife, which is a godsend for me. And she keeps she's the rock in the family, and she keeps me sane. So it's good. And we've had some good things happen to us, in the last month. Two grandchildren born, and they live right down the road from us. So it's a great thing. We're very happy about that.
Well, thank you very much, Governor, for taking time out.
Thank you for taking time to speak with us today. We really appreciate it.
Thank you very much.